Okay, good afternoon. My name is Lionel Bañez. I'm an assistant professor in the Division of Urology of Duke University Medical Center. This is a study looking at alcohol intake and the risk for prostate cancer, high-grade prostate cancer in the REDUCE trial. So the REDUCE trial was a chemoprevention trial looking at dutasteride and whether it reduces the risk for prostate cancer, and which actually they did find that dutasteride does reduce the risk for prostate cancer. So the objective of the study was to determine whether alcohol intake in these men was associated with increased risk for prostate cancer. And what we actually found was that heavy alcohol intake, that's an intake of greater than 7 units of alcohol per week, was associated with increased risk for prostate cancer and an increased risk for high-grade prostate cancer. Compared to men who did not drink alcohol, there was a noted 21% increase in the risk for overall prostate cancer in men who were heavy drinkers, and there was a 34% increased risk for high-grade prostate cancer among heavy drinkers as well, compared to men who were non-drinkers. Now, the other interesting finding that we had in this study was because previously there was a study looking at finasteride, another 5-alpha reductase inhibitor which prevented prostate cancer. In that study, investigators found that alcohol intake was associated with a reduction, or with it interfered with the risk reduction properties of finasteride in preventing prostate cancer. What we found in this study was that alcohol intake didn't modify or reduce or hamper with the risk prostate cancer risk reduction ability of dutasteride, which we thought was an interesting finding.